Good morning, everyone. Thank you for joining us for this press conference about fall recovery for Montgomery County Public Schools. This is an important conversation, and we want as many of our community members as possible to understand what we are envisioning for the fall with this initial framework. So I'm going to turn over this presentation to Superintendent of Schools, Dr. Jack Smith. We're going to have some information to share with you about the fall recovery and some other topics, and then we're going to open it up to Q&A. Again, a reminder, please stay on mute while we go through our topics, and then we'll handle your questions when we get to the end with raising of hands and open cameras. So Dr. Smith.
Good morning. Thank you for being here, for helping us share information with our community and with our families across Montgomery County. Certainly the upcoming school year is requiring a tremendous number of critical decisions as we think about how to approach teaching, learning, and the well-being of all students in this era of COVID-19. How our students experience learning and how they experience school has been different for the last several months. But we want to make sure that we approach the work thoughtfully, that we work together with our health officials, with our local county leadership, with our many stakeholder groups, as well as in the context of the state of Maryland and how we work with the State Department of Education, the state superintendent, and the governor's executive orders and requirements around how we all live our life in our communities right now. We know the abrupt closure of school on March 12th, the last day of school inside of buildings was March 13th. And then we had that 2-week emergency closure. That was very difficult for every single person in our community, every person affected by Montgomery County, and very difficult for every person in our state, nation, and in the world as we all dealt with the unknowns of COVID-19. And we know the uncertainties about the fall and the disruption that emergency closure and the closure for the rest of the school year causes really significant anxiety about this coming fall and how that will look. And we want to continue to communicate with you, share information with you, and make sure that you understand that the health and safety, the well-being of our students, their families, and all of our staff members is of the utmost importance while providing a rigorous, enriching, high-quality education that brings together equity and excellence for the experience of all children in our community. We've put out a draft framework, a draft plan. I want to make sure that everybody understands this is the beginning of this part of the conversation. We've had a lot of conversation through May and June, and now we're in the middle of July as we reimagine, reopen, and try to recover from this as a school system and as a state and nation. It's a draft plan. And as we think about how to bring students back into school buildings, the brick and mortar buildings, in the safest possible manner to ensure that the educational experience is what it needs to be, as I said, around being both excellence and furthering the cause of an equitable, all means all experience for every student. The guide offers a few recovery models that we're considering in the light of the information and guidance we've received from the Maryland State Department of Education. It offers information about how we've worked with our county health departments. It offers information about what the state requires and what the restrictions and constraints are on us right now in size of gathering and all of those things. And most importantly, we understand that when we consider these options, they have to be examined for the well-being, the safety of the students. As we think about the reordering and reimagining of teaching and learning, it cannot become an excuse for us not to pursue the best opportunity for every single child that we serve. Our students depend on this, incredibly so. This is not what any of us would have chosen. There are not great options here from which to choose. We have these circumstances in our community and in our nation right now, and it's up to us to work and do the best we can for our children, even though the 19-20-21 school year will start in the most unprecedented way that any of us ever could have imagined. And so we want to commit to you to continue to talk, to work, to improve, adjust, and change our plan to fit the circumstances that we're in. To know that we are listening to you, we are looking at what we know and understand about our students and coming together to serve all of their needs. There are many, many different issues we want to talk about, and Dr. McKnight's going to talk about a couple of them around the well-being of our students and some issues that have concerned us and some issues that we've been working on for a long time, and they have come to the forefront, and they're part of this conversation about how students experience school. So I will now ask our Deputy Superintendent, Dr. Monifa McKnight, to share some information, and then we'll come back for questions and answers.
Thank you, Dr. Smith, and good afternoon, everyone. I will be specifically talking today on a few issues. I will start with addressing the allegations of sexual assault that have come about. MCPS is actively looking into the allegations of sexual assault that have been shared by our current and former students and try to address them as quickly as possible. That's our goal. This is very personal to us, and we are absolutely enraged and saddened to hear about these allegations. We recognize the courage that it takes for anyone to publicly share a painful and horrendous experience of harassment, assault, bias, or bullying. And so again, this is very personal to us and we take it very seriously. Over the last 5 years, MCPS has taken significant action to strengthen abuse prevention efforts, enhance reporting protocols, and encourage greater cultural competence in the entire system. This includes mandatory training for all staff on sexual harassment, child abuse and neglect, implicit bias, and instruction for all students on harassment and personal body safety. We've had a student welfare liaison in every school who serves as the school's Title IX coordinator. We partner with the Montgomery County Domestic Violence Coordinating Council on the Choose Respect initiative, which seeks to promote respect in dating relationships and to raise community awareness about the prevalence of teen dating violence that does exist in our community. And we look forward to continuing to partner with those different organizations, as again, this is very important to us, and we know that as a community, we want to be collective in how we address these issues. However, we know there is still more to be done. We've asked that our Director of Student Welfare and Compliance, our Title IX coordinator, to lead a process involving all offices of our school system to ensure a thorough investigation is conducted into which valuable report and to take the necessary steps in response to what we find. MCPS has been and continues to be committed to creating a safe and to hear about these allegations. We recognize the courage that it takes for anyone to publicly share a painful and horrendous experience of harassment, assault, bias, or bullying. And so again, this is very personal to us and we take it very seriously. Over the last 5 years, MCPS has taken significant action to strengthen abuse prevention efforts, enhance reporting protocols, and encourage greater cultural competence in the entire system. This includes mandatory training for all staff on sexual harassment, child abuse and neglect, implicit bias, and instruction for all students on harassment and personal body safety. We've had a student welfare liaison in every school who serves as the school's Title IX coordinator. We partner with the Montgomery County Domestic Violence Coordinating Council on the Choose Respect initiative, which seeks to promote respect in dating relationships and to raise community awareness about the prevalence of teen dating violence that does exist in our community. And we look forward to continuing to partner with those different organizations, as again, this is very important to us, and we know that as a community, we want to be collective in how we address these issues. However, we know there is still more to be done. We've asked that our Director of Student Welfare and Compliance, our Title IX coordinator, to lead a process involving all offices of our school system to ensure a thorough investigation is conducted into which valuable report and to take the necessary steps in response to what we find. MCPS has been and continues to be committed to creating a safe and welcoming environment for all of our students. And again, we applaud our students for who have reached out to us, and we are committed to working with them and others to create that environment that does matter and that we are definitely committed to in terms of providing an inclusive, supportive environment for every single student in our schools and in our community. The next area of focus that I did want to bring to your attention was yesterday at the board table, we shared some general information about it and the purpose of it, but that will be our anti-racist system audit that we will conduct in Montgomery County Public Schools. So in addition to the global pandemic that we're all facing, And we know that the killings of George Floyd, Breonna Taylor, Ahmaud Arbery, Rashad Brooks, and many others have weighed heavily on the hearts and minds of many members of our community. Particularly these acts of violence, COVID-19 related deaths and illnesses, and gaps in employment are disproportionately impacting African American and Latinx families and students in our community. These tragedies have shown a spotlight on ongoing racism in our nation that is overt, covert, structural, and institutional. Educational institutions are undoubtedly contributed to this problem in some ways. It is important to acknowledge that MCPS has been on the forefront of disaggregating student performance data and confronting the gaps in achievement and access opportunities. We have made it our mission to build an equitable system of excellence for all. And today, we are confident that we're capable of and committed to accomplishing this mission. MCPS is committed to an all means all approach for student success, which I know many of you've heard before. While many of our students achieve at very high levels, not all have had access, opportunities, and resources needed to meet their full potential. We remain steadfast in our efforts to address disparities in student outcomes by closing gaps in opportunity and achievement for all students in all classrooms in all of our schools. And our equity and achievement framework provides the purpose, the path, and the plan to ensure success for those students. And so while this framework does provide an opportunity for us to be persistent in addressing disparities in student outcomes based on race, culture, income, disability, and language, we've made great progress in some areas, but there is still much more work to do. Data and evidence are critical tools that equip us to better understand what we need to do and create greater access and equity to do just this. We must continue to use multiple measures to determine if all of our students are learning. Our work to address disparities in student outcomes with an emphasis on focus groups representing African American students, Latinx students, and students in poverty have already been initiated through the Equity and Achievement Framework. And we offer cultural competence training to all staff to really combat the implicit bias in teaching and to ensure all students feel welcome and supported in all subjects and in all classrooms. So as a system, we know that another key component in this work is addressing students' physical, social, and psychological well-being. And our Be Well 365 initiative has been a linchpin in helping students achieve and maintain academic success. So we acknowledge that there are gaps and we continue to delve deeper into why these gaps are existing and the reasons behind why they exist. So as a system, we're looking deeper into how our work and commitment will move forward in our school system closer to close a goal of being a more equitable community. And an immediate next step is that we will conduct an anti-racist system audit based on the following areas. We're going to analyze our workforce diversity first. Secondly, identify the progress and barriers in work conditions throughout our school system. Third, conduct a K-12 curriculum review with a lens of equity for all subjects and all levels. Or we'll analyze the progress on the components of our equity achievement framework. Fifth, we're going to analyze community relations and engagement to make sure we're reaching all of our communities at a central and school level. And finally, we are definitely going to make sure that we continue to look at how we evaluate school cultures to ensure celebration of diversity and inclusion, because that is where we're going to make the difference. And we've shared before about our ongoing work to do that in our schools. So these are just some of the highlights of the additional steps that we're taking as a system to address the surge in incidents and to ensure all students have a safe and welcoming learning environment where they can thrive. And I'm confident that working together in our community, we'll see a significant improvement.
Dr. McKnight, you've muted your microphone.
Thank you. Did you hear the last part of what I shared?
Could you please repeat the last, I think, 2 sentences?
Okay, I just said that we're very confident on working on these things within our school community, and we know that we'll see significant improvement in our district based on the work that we do from this audit. And we look forward to partnering with all of our community members in doing just that. Thank you.
Thank you, Dr. McKnight. So if all of our media partners can turn on your cameras, but leave your microphones muted, and we'll go through and try to capture folks by raising your hand. So please just raise your hand if you have a question, and we'll go from there. So I saw Bruce was the first one up. So Bruce, have at it.
Superintendent, the Maryland State Education Association and the Maryland PTA released a letter to the state school superintendent and to the governor yesterday, in which they said that the only safe way to do school is to do it virtually in the fall. Can you give us your reaction to that? And I guess from your plans, you think that that's not accurate?
Well, first of all, our plan is to be prepared to open brick and mortar schools when we can. And we've said that all along. We have a lot of different critical decisions that will be made by different people as we move forward the rest of July and into August to make a hybrid model possible. So we'll continue to work on that. In terms of the Maryland State Education Association and the others, there are a tremendous number of perspectives across our society. Our goal is to work within the framework of what our officials require in the county as well as the state, and to work especially within the framework of what our health officials say is appropriate. And so if you watched our board meeting yesterday, our Chief Health Officer, Travis Gales, Dr. Gales, joined us at our board meeting for about an hour and answered some questions. And what he says is that as we move forward, we'll know if we can open in the way we've described or in a different way in brick and mortar schools, but we're going to open schools on August 31st for all of our students. And it'll be, we know at that point, it'll be a remote learning situation. And then we're going to see how we can move into other models as that becomes possible.
Thank you, Dr. Smith. Kate Ryan, I think you were next.
There we go. I had a question about the sports programs. I know that there are concerns about whether or not you can have sports. I think a board member O'Neill brought that up, and I don't know that Dr. Gales was able to answer that question. What is the status? Can you have sports? Practices would begin pretty soon, wouldn't they?
Practices traditionally begin in mid-August, and we will once again go forward. Dr. Gales cannot answer that question at this point, but as we work with him, as we work with our constraints in our county and state restrictions and constraints, and with, remember, sports are all governed in Maryland by the Athletic Association that works under the auspice of the Maryland State Department of Education. So our direction will come from all of our health officials and our state government through them to us, and I expect we'll know in the next couple of weeks what the status of high school sports will be and how that will move forward. We all remember the spring, it wasn't what we would have chosen, but as they made decisions, we followed them and implemented the decisions they made, and then tried to provide activities for students that were allowable under the restrictions that have been put in place.
When might people know?
I think, as I just said, by the end of July, everyone should have a much clearer idea, because at some point, all of the different entities involved in this will have to come together and make a decision. But I can't imagine that they'll allow sports that are outside the restrictions that are in place for the community and for the school system and all the other restrictions that might be in place at that time.
Got it.
Thank you, Dr. Smith. Thank you, Kate. So next up, we have Channel 7, Kevin Lewis, followed by Bethesda Beat and Caitlin.
Hi there, can you all hear me?
Yes.
What did the results, were you surprised by the results of the survey that concluded in recent weeks? Or is it what you expected?
No, I wasn't surprised by them. I think that obviously I didn't know what they would be, but as people responded, over almost 60,000 families and community members responded, about 16,000 staff members responded. And we looked at those as they came in all the way along. what we began to see were trends and patterns, priorities, things that people said they thought were most important. We showed all of that at the board meeting yesterday, so our entire community. I think the people that were surprised were the ones who said 100% of the people agree with me or 100% of the people agree with you. I think what we see are many, many different perspectives, priorities, and preferences here in this situation. It's just up to us to work through them as a staff and as we work with all of our stakeholders in the community.
Thank you, Dr. Smith. So Bethesda beat Caitlin, and then Montgomery Community Media.
Hi, Dr. Smith. Good afternoon. Good morning. It's still morning. My question for you, are there any liability issues in reopening schools? When you do move in that direction, do you envision families at all having to sign waivers or otherwise acknowledge that there is a risk in sending kids back into school buildings? And building off of that, will you legally be able to let families know if their child has been exposed, or would that be a violation of privacy laws?
So there are liability issues every day in life, every day in our community, and every day in schools. So I would be silly to say there are not liability issues. How this will work out and how all of the different pieces come together, we're exploring right now in terms of the liability. But we also absolutely will be able to let parents know if their child has been exposed. And that would be an absolute necessity in our work. And we'll have to figure out how to do those things within the framework of the laws and the rules that exist in our society.
Thank you, Dr. Smith. Next up, we have Montgomery Community Media, and then Fox 5. Miriam, I think that's you. So let's come back, Fox 5. All right, how about DVM?
Good morning, everybody. Randy Bass with WDVM here. Thanks for having me on the call today. I wanted to ask, and I'll open this up to both Dr. McKnight and Dr. Smith. Has MCPS discovered any non-public health related benefits to online instruction? Has anything positive come out of this process and planning and moving folks to online instruction?
Well, I will start, and then I'm going to ask Dr. McKnight to share her perspective also. That would be good. We've heard from lots of families about their experience. And of course, those experiences have ranged the continuum from difficult and troublesome to very good. What I've seen as I've read many, many messages from family is that some students actually prefer this model. I don't think that's a majority or an overwhelming number, but there are students who prefer it. And actually, as I look across my 6 grandchildren, 5 of whom go to school, I do have one of those 5 that actually has done better in this environment as an elementary student than in the regular school setting. And so I think that it's very hard to generalize about this. The other thing I think it did is it dragged us into the 21st century, that whether we're in brick and mortar schools or in this environment, we need to have students engaged digitally all the time, every student, everyone connected, because this is the way the world works, as we know. Dr. McKnight, your thoughts about this?
Sure, absolutely. So one of the positives I'll mention is that our community have expressed much gratitude for the option that we are actually putting out surveys allowing families to make a choice about this. This is a very personal experience for many people. None of us have ever had to navigate a health pandemic before, and many people feel many different ways, and there are many different situations in a variety of households. That speaks to the decision really has to be about what they're comfortable with. So that's been a positive, knowing that many families feel like, we have heard their feedback and having options available. Secondly, I'll say we have learned through our continuity of learning virtual platform, as well as our summer program, which just got started, that families are reaching out and sharing This summer, many of our elective programs, arts and social justice and arts and things like that, are programs that our students are loving and they are thriving in. And many of our staff members had an opportunity through implementing the continuity of learning in the spring to really learn what are the things that we navigate in this virtual environment that students thrive on. And so we have gotten some positive feedback about that. And as a parent myself, my son who's 8-year-old who was in an art camp asked my husband and I, could he take it again for a second time? And so, for another week. And so I just want to highlight how important electives are for our students who are managing many social emotional circumstances at this time themselves by working under our current constraints.
And Dr. McKnight and I were on a phone call with about 10 people this morning. We heard from 2 different families who shared what a good experience their child is having right now in summer school programs. And earlier I was asking a question about the association letter that went to the governor and Dr. Salmon, and I want to read this sentence to you. The most prudent course of action now is to focus on how we can provide the highest possible quality of virtual learning during the first semester of the school year, during the time which we hope the virus is mitigated to a level which will allow for subsequent expansion of in-person learning. And then lists a whole set of bullets on how we can do that. And so we certainly intend to work with all of our staff because this is the 21st century. And whether we're doing this in this manner, whether we're doing it in a room here in the central office where I am right now, or we're doing a combination of the two, which is the world of media that you all know and understand well, we have to do it, as they say, the State Association for Teachers says, the highest quality of experience for our students in virtual learning.
Thank you, Dr. Smith. Next up, we have Aisha from Fox 5, followed by Annika from Silverchip.
Hi, Dr. Smith. So I've been just talking with parents, just various Facebook groups that I follow, and I think one of the questions that came up was, this is just out of concern for many parents who are full-time parents and full-time jobs. What resources are possibly going to be given to parents to help them continuing this online learning once kids go back to school, and what resources will be available to help parents of kids with special needs or other learning disabilities. There were a lot of different issues came up. Another one was about what help will be given to parents who are single parents that live paycheck to paycheck, and now one has to stay at home to teach them online, making it nearly, if not impossible, financially to survive. Or what about the kids who don't have an adult to help them with this? So it's just a plethora of questions, but I just kind of want to know the overall, what other resources will be provided for parents who have such concerns?
Absolutely. Certainly the circumstances of our parents and our families vary widely across our entire community and all over this country, and we have to be very cognizant of that. One of the things we did with our budget this year is to make sure that we're focused on getting digital tools and connectivity to every single student. So students aren't sharing them in the home, or they're not dependent on us to make sure we provide a Chromebook in a parking lot like we had to. And so that's been a big part of our effort. Another part of our effort is to build out time for adult learning, to make sure that our adults really do know how to in essence, reach through the computer and support the students, support the family. And we're really going to approach this as an all hands on deck effort this year. In the spring, it was crisis circumstance. It was emergency circumstance. As we approach the fall, we're going to use what we learned in the spring, what we're learning now in the summer, to really find more and more effective ways to support our parents. And the third way is to really look at where our students are when they come in September in their learning and in any loss they had or gaps they experienced in the 6 months from March 15th until the beginning of school, and commit more time and more resources where students are having a problem, so that we will differentiate in how we provide that adult support to children across our community. And I know that isn't everything, but we're going to do what we can to mitigate this. And I would call on community leaders to also really use their resources to support families in these circumstances in education and housing and anywhere else. And I think ours have, and they need to continue to do that. Dr. McKnight, are there things you want to share about the work that you and your team have been doing, kind of on the ground, practical ways to follow up with this?
Absolutely. So we have been thinking about, again, every household that exists and implementation of this recovery plan. And so that's why we presented the options that we have. Another big part of what we are connecting with our community members, as Dr. Smith just said, as many have reached out and are willing and wanting to help, and really looking at the plan and say, how can we support? And so I look forward to us continuing to have those meetings over the next few weeks and months, and quite frankly, as long as we're in a situation in which we're navigating this health, because it is going to require an entire community to come together to support throughout all of the adjustments we've had to make with normal traditional structures as a result of COVID-19.
Thank you, Dr. McKnight. So we have Silver Chips followed by NBC4 and Chris Gordon.
Switching gears a bit to the sexual assault investigation, Dr. Smith and Dr. McKnight, it's viable to describe allegations. So if I can ask, what makes an allegation viable?
I'm sorry, could you repeat that question? There was some interference that came on while you were speaking.
Yeah, sure. I was asking what makes an allegation viable?
Sure, we have our team here. And so I'll turn over to Dr. McKnight, or she can ask Mr. Edmondson to talk about this. He's here also, and they're looking at each of these circumstances closely, and they can talk specifically about the criteria that is there. So Dr. McKnight, Mr. Edmondson.
Sure, I'll have Mr. Edmondson chime in, but I think the first step is to be able to make sure that we hear from everyone who's made an allegation so that they can make that connection, so that we're able to look into all of the situations to determine based on the criteria that Mr. Edmondson will speak to. So that's initially been our first step, as we've had many folks outreach in many different ways and making that personal connection with them. Mr. Edmondson, do you want to speak specifically about the criteria?
Sure. So just to address the viable question, we consider all of our concerns, issues, or complaints as viable complaints. Now, whether or not they would qualify as an official Title IX case, we certainly run that through our legal department. We run it through our collaborative efforts with our state's attorney and our police department. So each one of the cases that comes in is a viable case for us, and we take it extremely seriously, and we run it through our process to make sure that we've done everything we need to do with not only reporting, but also following up with student support and possibly code of conduct issues. But our school district position is, we take every case as a viable case, and whether or not we have to categorize it, or whether or not we do categorize it as a Title IX sexual harassment, or even if it's an assault where our special victims unit of the police department will get involved, that depends on the details and the context of each case.
Thank you, Mr. Edmondson. So next up, we have Chris Gordon from NBC4.
Thank you very much. I've unmuted. I hope you can hear me.
Yes.
Okay. Last Thursday, we had a very well presented tour of an elementary school, saw the social distancing, the lineup, the school bus, the hand sanitizers, and we realized there just isn't enough space. In the classroom, maybe 50% capacity, on buses 25%. A day or two later, it came out that Montgomery County was going to be starting with virtual learning through November. What I'm asking for today is if you can give us the scenario, in other words, as if you're talking through us to parents, what they can expect today, because today we're going to be presenting some of the Virginia school systems, DC school systems, a concrete plan. So to the degree that you can lay out your concrete plan and the timetable for whatever other decisions, trying to decide, for example, are you going to, if you go in school, rotating 2 days a week, every other week? What can you tell us at this point?
So first of all, let's clear up some misinformation. The plan, the draft framework that we put out, the initial plan, didn't say we would stay virtual until November. It said we'll start virtual, and then it talked about once we start phasing students in, whenever that happens, that probably will take 8 to 12 weeks, which could take us to November. So a lot of people have kind of, they've added up the weeks and decided that must be the end of November as they think about that. So we're going to start virtual on August 31st. We're going to continue to work with our health officials, our county leaders, our state leaders, and we're going to make a decision about where we go. And ultimately, the Board of Education will approve that decision. And they provided a lot of feedback and a lot of questions yesterday, if you watched their meeting. So we're going to meet again with them on August 6th. And we're at that point, everybody knows we're going to start virtually right now. That they all know that. When we start, and I'll even say if we start, because we all know if there's a dramatic increase in cases, we may not get to start by November to have brick and mortar experiences. We're going to wait and see where that is, but by August 6th, we will say we're going to, we all know we're going to start virtually, and that it's our goal to start on such and such a date to bring students and staff back into schools if the conditions and the trends continue to stay as they are now. That's exactly what's going to happen. Dr. McKnight, is there something else that you'd like to add to how we're thinking about that?
I think you covered it, Dr. Smith. That's exactly what we're thinking. Chris, we appreciate you raising that, because sometimes we put information out and people add up, as Dr. Smith said. And so we were surprised when we heard about the starting in November as well. It was never our intention to start in November. However, we did want to make that that space flexible and let our community know that we are starting online. And as soon as we are able to and have the support of, like Dr. Smith said, our local government to start that rotation, we will begin that. In terms of your question specifically around the rotation schedule, the goal for the option of virtual and to have an in-person experience was to allow students the opportunity to be able to rotate, particularly our younger students, to rotate through to have an in-person experience on a schedule twice a week starting out. Dr. Wilson, if you'd like to give any more context, or Ms. Hazel, to that specifically, just so that they'll know if we're able to accomplish that, exactly what it would look like, or what we're.
Thank you. Thank you, Dr. McKnight. Yes, certainly there is the virtual only model that we're starting in, and then the hybrid models are certainly all impacted by some variables that as a system we need to determine. And first and foremost, it is what parents want for their children. The degree to which we need to support them in a virtual only model, or the degree to which we can support them in a blended model. And also, we also have logistics to work through in terms of staff location, who will be providing that instruction virtually, and who will be providing instruction in an in-person model, and really making that match at each building level in terms of what a blended model would look like.
Thank you, Dr. Wilson. So anyone else for a first round of questions from the media, or we're going to go start with second round? Going once, going twice. Kate Ryan, WTOP, your second question.
Thank you. I wanted to ask about transportation. That issue came up in some of the testimony to the board. I know that for some kids who are dependent on ride-on services, there have been changes to those services. They may not be able to, for example, get up to Poolsville in a timely way. What is being done for those students who simply don't have access to a mom or a dad who can bring them to school? And if I can fold this one in real quick too, what about, do you have a determination on how many students may have kind of tailed off or dropped out of online access? What's being done to make sure that each and every student is accounted for?
So I'm going to answer your second question first. We developed some very specific criteria during the second half of the remote learning in the spring. And so certainly by late April, we were able to set some criteria about the number of times a week a student was engaged. And we also worked to make sure in those very small number of cases where families chose or were in a circumstance that required that they use paper, that we also used other methodologies like telephone calls and emails to make sure that we had engagement with them. And when we reported our statistics and our percentages, they were against that criteria rather than just, you know, we've sent an email to the student, or we tried to call their family, therefore we're engaged with them. And so we're going to continue to work with that. We're working with the Maryland State Department of Education to make sure that our enrollment and attendance policies and rules fit this new world that we're all in, because as Dr. McKnight just said, some families are going to be in the virtual world, you know, for the foreseeable future. And they're our families and our students, and we want to serve them well. And whatever system we're in, we're going to make sure that we have a rigorous standard. And then when we don't hear from a student, or we think they're absent, you know, for an extended period of time, for a few days, just as we did before all of this happened, we're going to use a case management strategy, and we're going to go find those students. And we did that this spring with our seniors. We've done it with all of our children at every school, and we're going to keep that up. The second question around transportation is a very good question. Before any of this ever happened, we were working with the Montgomery County government to make sure that the ride-on buses were fully available to our students, given the legislation that passed last year to give every student access to the ride-on buses 24 hours a day, 7 days a week. And we really appreciated the county council's effort in that. I'm going to ask Ms. McGuire, S.E. McGuire, to talk about how we've been thinking about transportation, both in the regular systems of picking up students and dropping them off, as well as those exceptional cases where students may need transportation that doesn't fit into that regular system. Ms. McGuire?
Thank you, Dr. Smith. So yes, we know that our transportation resources are going to be very important, and they're going to be affected, of course, by the capacity limitations that we'll have with the public health requirements. But our first step is really going to be to understand very specifically from our families who needs that transportation resource. And that way we can really be sure to tailor our resources to make the most effective and efficient use of our transportation school buses to support families. So that'll be our first effort, is really working through our schools and through our outreach staff to be sure that we connect with the families who do need the transportation resources. When we have that information, then we can really structure a system that, again, provides that to the maximum extent possible and just makes the most uses. We also, though, are, as Dr. Smith said, working very closely with the county, because we do know that we will benefit and will really need to bring other resources to bear to be sure that we can support our students and our families. And so we're talking with our partners at the county transportation. The Kids Ride Free program is a great opportunity for our secondary students, particularly high school students, but we do know that the routes need to be there to support them. And they've expressed that willingness to us to really work through that and really provide that additional support. So we're confident that we will be working with them for solutions. And I just would say that we really appreciate people bringing those specific route concerns to our attention, because then again, that's something that we can follow up on. And if we know there's a need there, it really is a useful piece of information. So we'll be looking at non-traditional solutions as well.
Thank you, Ms. McGuire. And S. McGuire is the Associate Superintendent for Operations. Next up, we have Bruce Lashanigan.
Hey, just two things, if I can do it quickly. Clear communication, obviously critical in a pandemic. So I just want to make sure I have this straight. The plan right now is to start online, and then you don't know whether you will go into the school buildings or not.
We have not made a final decision when and if we will go into the school buildings. That will all be driven by the context and the health circumstances in our community.
Okay, and then quickly, if I can, one particular thing that the MSEA and the PTA raised was the disproportionate impact on Black and Brown families. And I was shocked to hear that 74% of the Montgomery County cases are Latinos. what can you do in particular to reach out to these communities? What special work are you doing with those communities to make sure that they're served?
As I shared a few minutes ago, we structured our budget as we moved into this pandemic circumstance in the spring, and really went back and looked at our budget, and any available money that is in our budget, we have put toward the digital tools, the connectivity, so those tools can be used in the home, in the neighborhood, on the bus, wherever the student is. So every student will have that connectivity and those digital tools. We structured around adult learning so that we can differentiate in ways that we would typically do in the actual physical classroom. Now, how can we do that in the digital world and through the computer screen, through the telephone, through the email, those sorts of ways, as well as retraining our adults to really think of this as a case management sort of circumstance. And then the third way is through time. We have 75,000 seats this summer in summer school. That's about over 40,000, I think it's 43,000 individual students. That's about 3.5 times more students than we typically serve in the summer. We want to create time this summer and all throughout the school year so that we have caring adults who are well prepared to reach through the computer, to go through the phone, and in some cases, as we did in the spring, to deliver Chromebooks to homes, we deliver meals to our communities, all of those things that we can do. I want to be clear though, this is a community effort. Everybody in our community has to be involved in this effort. It cannot just be the school system, but we can certainly do everything we can do on behalf of every student.
Thank you, Dr. Smith. Next up, we have Caitlin from Bethesda Beat, and then Annika again from Silvertip.
Hi again. Can we pivot back for a second to the sexual harassment and assault allegations? In your community message sent out on July 1st in response to student allegations, you said MCPS would take a deep look into the culture that exists in our schools and how it may differ from the values we hold as a school system. But I don't think there's been a whole lot of detail about what that process will look like. What is a review of school culture? What are you looking for, and how are you looking for it?
Well, we have been looking at school culture for the last few years around bias and around in our Be Well 365 program in the way adults interact with adults, students and adults interact with one another, and students interact with students. And we've been developing ways to gather that information from our students about their experience, because the experience of school is your well-being as a student and your academic progress as a learner as you move toward college, career, and life. And so as we've been putting all that together, we have teams of people working on that and thinking about how to do that just in the same way we do around the issues of racial justice and what is that school experience for students. Dr. McKnight, you want to talk about some of what your team has been doing around creating ways to gather the information and then, more importantly, respond to what we hear and know as we gather that information?
Absolutely. Thank you, Dr. Smith. So Caitlin, to your question, as we shared as well today, the anti-racist system audit, I just want to share how Dr. Ibram Kendi defines anti-racism, and it's anti-racist requires every individual to choose every day to think, act, and advocate for equality, which requires a change in systems. So as we think about that, it gets at the culture of different schools in every single way. One of the areas that we pointed out earlier was that in this audit, we would be doing the evaluation of school cultures, and it fits right into exactly what you asked. Your question was related to sexual assault, but when we evaluate the culture of a school, that's an opportunity to evaluate, is that culture a healthy one as it relates to the well-being of students? That's race, that's interpersonal interactions with students, with each other, interpersonal interactions with students and the staff. It covers all of that. So in terms of the actual follow-up of what that looks like, that is inclusive as a portion of the anti-racist system audit that we're doing in MCPS. And thank you for raising that question to make that connection.
Thank you, Dr. McKnight, and Annika from Silverchips.
I've actually first got a follow-up to that previous question, if that's okay. I believe that in the recent past, there was a WilmerHale investigation that was done school-wide about bullying and harassment. Is anything similar to that on the docket based on the mass movement in MCPS recently?
So the WilmerHale was really around those issues as they occur or play themselves out in after-school activities, in extracurricular activities, in sports and drama and music and all those areas. And we've implemented a number of things this year as we move forward, and those will be more specific and more appropriate to in-building experiences. But we're still building that framework out this year as we think about how to have more adults interacting with students about their experience in the school, whether it's in an athletic team, a drama group, a music group, or the chess club. It doesn't matter. People treat one another certain ways, no matter what the activity is that's going on. And now to build from that, the larger school experience, and back to Dr. McKnight and what she was just saying, to really know and understand the culture of the school and then respond to the culture of that school, whether it's in the classroom, the hallway, the cafeteria, before or after school, on Saturday, on Sunday. Dr. McKnight, you want to talk a little bit more about that work as it pertains to this question?
Absolutely. So that whole component of the culture of a school, it actually gets at the discussion that we've been having with you all in the community now over months. If you remember, I believe back in February, before we all started to navigate circumstances of COVID-19, we were talking about hate and bias. And we were given this exact same context of how we would be working with our schools to look at how that exists, persists, or does not exist, and reasons why in every single school. So the Equity Initiatives Unit, as you know, is a part of the Deputy Superintendent's Office. That was one of the changes we made in our organizational structure this year. And much of their work is exactly focused on that. And it's how do we bring that lens and make it pervasive in every school building, in every classroom, in central office, throughout the entire system, and how we work with others and each other to create these healthy environments. What we've learned through what we've navigated through COVID-19 and some of the things I spoke earlier about race is that based on historical structures, based on traditions, based on thoughts, biases, all of that, these are human beings that we have to try to transform change within. And those human beings start from our students who come into us in kindergarten. They may, they're come in very palatable, very moldable, all the way to our high school students who, have had experiences over time that have shaped how they see the world. And so we are committed to continuing to do that work as a system. And it's all connected as we look at this hate bias, sexual assault, racism. We don't look at these things differently. It all is related to how we create a healthy environment for the needs of our students so that they can thrive and learn. And so, we are moving forward with that work, and we'll continue to update you all on it.
Thank you. I did have one more, if that's okay. So I guess it's more on the minor side about student engagement, but one of the issues in the student body in the spring was both that teachers weren't necessarily comfortable with technology, and also that there was a lack of standardization across platforms, using things like Google Classroom at the same time as my MCPS, et cetera. So what steps is the county taking to kind of mitigate those challenges specifically?
A lot of steps, we really have, and we're working on those, and Dr. McKnight has her team here, and so I'll ask her to give the very specific ones because they've been working on moving to a single platform, a set of platforms. All of those things have been under discussion, and that we've been keeping lists as we work through those concerns from the spring. Dr. McKnight and your team?
Our community has been most helpful to us in that way by providing us feedback, starting with the continuity of learning online platform that we hosted in March, the end of March, all the way through June. And so one of the very things that we heard from our students and our parents early on was the difficulty in navigating different platforms. However, there was, and we shared before, there were reasons we did that because we all had to put together a system. And so we had to start from a place of who had what knowledge that would allow us to be able to connect as quickly as possible under those circumstances. And at that point, we had to acknowledge that we had some students and we had some staff who were more versed and comfortable in working in those variety of platforms. From that time, we started our conversations in April and May and knew that there would be absolute benefit to our community based on what they've shared, to our students and everyone to work through one platform, which we built and didn't know this would happen, but built and can perform well. And that's our my MCPS platform within the system. So Dr. Wilson, if there's anything you want to add to that, please do so, because I know we had many conversations with many of our partners, internal and external, about planning for that if we needed to extend, and here we are.
Thank you, Dr. McKnight. Certainly, we did hear loud and clear from our users that there was not a lot of coherence when they had to move between different kinds of delivery systems. So the move to a single platform through our MyMCPS format is really in the best interest of our students and our learners, and also helps our parents and guardians support students because it's a single place to go. I do want to make mention that in our platform, there will be opportunities for teachers to share content, and that also creates a situation where we can provide a lot more opportunities for students instructionally because of the time and talents that teachers put into certain types of delivery of certain content, I think is very beneficial to our students. So being able to be on that single platform has lots of collaborative energy potential. So thank you.
And Dr. Wilson, I also wanted to raise that we've provided many professional learning opportunities for our teachers since the spring on this platform to be able to allow them to transition before, during continuity of learning, if they chose to do that, or to do it in preparation for the fall. So that
absolutely, and those are ongoing. Thank you for mentioning that.
And there is a focus in our budget to continue that professional learning for adults in order to better support students throughout this year. That focus is one of those 3 great priorities that we have this year.
Thank you. So we're into our last 2 questions. First, Caitlin from Beside the Beat, and then WTOP.
Hello again. In talking to teachers over the past 4 days about the draft fall plan, they've raised a question that I think it's prudent for Dr. Smith to respond to. When we talk about the possibility of reopening schools, MCPS has acknowledged that there is some level of risk in doing that as far as transmission and contracting the virus. But from your perspective as the leader of the school district, what is the acceptable level of risk? What level of possible transmission are you comfortable with in order to have in-person classes in the fall? And then building off of that, can you please just outline specifically what measures the school district would have in place to reach that goal, whatever it is?
So that question is one that goes around a lot and people ask that question, but there is not an answer to that question, Caitlin, because what's the acceptable level of risk of life? I could walk out right now, drive down the street and not live to see tomorrow because I get in a car wreck. So there's not an answer for that question. What is appropriate is that we work with our health professionals and that we make a determination about what is possible and appropriate, that we work with our staff, giving their very individual circumstances. You know, as a 60-something-year-old man that's having a birthday in a month from now, a month and a half, I'm at risk according to the numbers. And I know a lot about statistics. That doesn't say I'm going to die of COVID-19. That says that people my age have more risk than people who are 30. But yet I've known people who are 30 who've succumbed to that disease. And so what we have to think about is, as we live our lives, what makes the most sense? And as all the people in our community live their lives, and that they go into Target, they go into the post office, into the fire station, they also have risk. We all have risk in life. So rather than an acceptable level of risk for schools, what do our health professionals say? What does the evolving research say about what we can do? What is each individual's circumstance? And what are the choices that we all make every day about the risk that exists in our life? And each one of us ultimately has to make that decision ourselves. And we also have to make it in terms of the work environment. But we were making those decisions long before COVID-19 about the work environment. That's why we have the employee assistance plan. We have all sorts of other supports for employees, just like most employers do. And we want to make sure that. So we're going to move forward very thoughtfully, very carefully, and then we're going to make decisions, and then individual adults will make decisions, and then we'll make decisions. And it's that ongoing work that is what it will be required for us to move back into a different environment than we're all sitting in right now. And when that will happen, I don't know. And anyone who tells me they know the absolute right answer about any of these issues, I question their credibility. I'm sorry, it doesn't matter if it's someone next door to me, across the country, across the state. No one knows the exact answer for any of these issues. If they say, I'm 100% sure you could start right now, then I question that. If they say, I'm 100% sure you should stay out of school all year and do remote learning all year, I question that, because we don't know what the future is and we don't know what all the risks are. But we can look at what we do know and make good judgments about that as human beings collectively and individually.
Thank you.
Thank you, Dr. Smith. And the last question goes to Kate Ryan from WTOP.
Thank you. I know you have teachers at the beginnings of their career and you have teachers towards the end of their careers. Are you seeing an increase in the number of teachers opting for retirement? And for those teachers who are starting, I know what that's like to be a first-year teacher. What kind of training are you giving them? The challenge that they have of not even being able to be in the room with the kids they need to bond with has to be pretty major. What's being done to help?
That's a great question, Kate. And yesterday we talked at our board meeting about our human resources department and the work they're doing around the new educator orientation. And as we think about the highly experienced among us, like me, then we certainly understand that they have different concerns. When you think about it, some of our newest teachers are actually at an advantage digitally. And I'll just use myself as an example compared to me. I would love to go teach high school English right now, and I might, but I would really have to spend a lot of hours with the smartboard because I know how to operate one, but at the most foundational level. At the same time, those highly experienced educators out there have a lot of knowledge that our newest teachers don't have about the school environment and students and relationships. So it's really working through that. So we've set up a new educator orientation for this August that's going to be profoundly different than it has been in the past, as we expect them to start with the virtual, remote learning and really providing them targeted specific support and help in that area. And as our experienced teachers, come together with their teams and sharing their knowledge and support and mentoring of the younger ones, and the younger ones sharing their digital native knowledge, that they know how to make all of this work well. And it's going to be that kind of collaboration that's going to make all the difference. I've got to ask Dr. McKnight to weigh in on this because she's been working with reimagining our HR system, and they had an extensive conversation at our board meeting yesterday about this very issue. Dr. McKnight?
Sure. That presentation yesterday really was to highlight how the efforts of human resources, which again is another office in our change in organizational structure, sits in the deputy superintendent's office, my office. And a big part of the discussion we've been having since March is how do we actually embrace human resources from a virtual perspective, which is much of what they shared yesterday. As you all know, every year we have a big, robust welcome of new teachers to our system, where we put hundreds of new teachers and energy and excitement into a room that off to a great start about their first teaching experience. Well, yesterday, our Human Resources Office and Department of Professional Growth and Development really talked about a virtual plan of how teachers would have been engaged to do those very same things, to create that partnership, excitement, and connection with one another as they start out in their careers in a very different way, knowing that we are going to have new teachers come in this year. And not only were we devoted to making sure we do things such as help them become equipped in utilizing the strengths that exist to navigate a virtual environment, but also to make that connection with each other. Mentorship in this profession is important, so critically important. And as you talk about that experience and novelty, you know, having our teachers work with one another to actually build on each other's strengths, experience, novice experience to experience that has existed over the years, it's what's going to help. And so creating that mentorship for our new teachers, professional development, and that connection has been a focus of what we intend to do to make this virtual platform one that thrives in all of our work of human resources and development of our teachers and other employees as well. Thank you.
Do you have a number though of teachers who are opting to leave, who are saying, you know what, this is not for me, I'm done?
We haven't actually seen any increase in retirements or resignations so far. We just looked at that information yesterday. You can look at our board docs and see the numbers, and so far they're consistent with the past years I've been here. And so, you know, it is a fair question, and we may see some change in the future, but Montgomery County Public Schools has not seen a surge of retirements or resignations as of this time. In fact,
thank you, Dr. Smith.
Derek Turner could send you that information from yesterday's. It's in the board report yesterday. It's in the consent agenda, Derek.
Great. Now we'll forward that along. So thank you, everyone. We're a little over time, so I appreciate everyone joining in. I just ask that as you run your stories, there's a feedback form that we have available to our community, because we do want to hear from our community so that we can revise and refine our initial framework. It's MCPS-submitfeedback.org. If you could put that in any of your stories, because we do want to hear from our community. We do want to hear from our parents and staff and our students. So thank you so much, and have a great morning.